Digital breast tomosynthesis. It's a technique used for imaging of breast, which utilizes technology which is very much similar to conventional CT scanning. So it combines the digital image capture and processes the images with simple tube detecting motion. Some of the technical differences from CT scan is like instead of full 180-degree rotation, this tomosynthesis captures the images from limited angles, like from 15 to 16 degrees. It takes multiple images which are then digitally processed to yield the images which is at par with conventional tomographic image. The benefit of this is like it involves very less radiation dosages compared to the conventional tomographic imaging, and it is very much cost effective to the patient also. So it can be a very good and useful modality of investigation as far as breast imaging is concerned.
So here I will just show you by mammography films that how the two image modalities are slightly different and how digital breast tomosynthesis has a slight edge over the conventional mammography. So I have selected two patients in their mid ages and with relatively dense breast, where the mammography cannot clearly or distinctively show us the lesion in question. So the first patient here is a 45-year-old lady who has got a retroareolar lump, which on mammography is depicted by a yellow arrow, so which we can see is not too much distinct. Whereas if we see the digital tomo film of the same patient, then we have a clear-cut distinct retroareolar lump very much visible on digital breast tomosynthesis image. Apart from that, we were able to identify another similar morphology lesion at around 9 to 10 o'clock position, so that made it multifocal tumor, which actually changed our treatment decision from breast conservation to mastectomy. And we could able to identify a lot of microcalcification in the upper quadrant of the breast as well in the same patient, which was not very much apparent on conventional mammographic images. Here there is another patient, again middle-aged patient with moderately dense breast glandular tissue having a lump in the upper inner quadrant. This is the CC view. So on mammography there is a lesion visible, but it cannot better delineate its morphology or its characteristics. So however, we could make on mammography that there is a lesion which is suspicious. So the same patient was taken for digital breast tomosynthesis as well. So it could very well tell us that it was BIREX 5 lesion, and then we went ahead with biopsy of the same patient, and it eventually turned out to be digital breast tomosynthesis is practically very much useful where patients have more dense breast, where conventional mammography cannot characterize the lesions to a great extent. So there the digital breast tomosynthesis is of great help. Thank you.